information that you hold that can be helpful to Rowie and I, and also to the participants on this webinar. So that being said, let's look a little bit at our agenda. So today we have a pretty full agenda, so we're going to keep the pace up. And you know, we're hopeful that you walk away with a lot of this information is higher level, but we hope you'll walk away with some things that you can really think about and potentially implement within your organization as pertains to a telehealth program. I know some of you are just thinking about a telehealth program. Some of you jumped in with both feet during this pandemic to start up a telehealth program or some kind of video audio platform. And then others of you may have started this process even before COVID-19. So again, we have this range of experience with us here today. So a little bit more about the agenda, and then we're going to go to some participant polls, which we could certainly use your help with, again, to tailor the information we're going to present today to the participants on this webinar. But we are going to be looking at a background about telehealth, kind of what is telehealth, how has it been used in healthcare to good advantage, you know, what are the ways that it can be used within a social service system or organization. And then we'll move into kind of a program development phase. So how can you strategically, thoughtfully, safely move into creating your own program? And then a final discussion about what the future of telehealth looks like, how you can be a part of that future, hopefully, and what some next steps may be for you. And then hopeful to leave some time at the end for some questions for you. So lots to do today, and I think lots of great information. So let's go ahead and, Teresa, if you don't mind, we're going to do 3 participant polls before we start. And Teresa, if you don't mind, go ahead and queuing those up.
Okay, there's that first poll.
So this is for everyone to answer, please.
Okay, so as we are going along, there's a few people that still need to vote, but the question is, does your organization have the ability to offer digital communication with clients? Pick all that apply. So the majority of people have picked the first one. Yes, we have a platform to do audio and video communication with clients. That's about 67%. 23% voted, yes, we are offering text messaging. 0% have offered, yes, we are offering chat messaging. And 32% voted that no, we do not have this capability at this time.
Great. And I know in the last presentations that I did, we had pretty similar results. And, you know, I bet if we were doing this presentation 6 months ago, it would not be 67% that had that capacity. So congratulations to you all. I know many of you are used to working in crisis situations and kind of running toward the fire and jumping in with both feet. So congratulations to you all who have kind of jumped in to start some sort of program.
Okay, so we're going to do the second polling question. Oh, and it looks like Perry Lawson at COPE says that they do have a chat. for the
Okay, great.
That's pretty neat.
Good job, Harry.
Okay, so I'm just going to give it a couple more minutes, or seconds, should I say. All right, so I'm going to end the polling. And actually, let's see if I can share the results. There we go. So it states, could you use more support in implementing digital communication, telehealth with your organization or practice? 89% said yes, and 11% said no.
Great. So what that's telling me is, yes, many of us have started programs, some of us not yet, but there is this need for some additional support, which is probably why you're on the webinar today.
And I would say it goes back to that theme, because it seems like almost 70%, told us that they have the tool, but there's still the need to implement the program. Because again, I mean, this goes beyond the acquisition of Zoom or some kind of means for a video chat.
Agreed.
Okay, so we're going to do the last poll. Okay, it looks like almost everybody's done voting. All right, I'm going to go ahead and share the results, and here they are. So it states, what are your greatest concerns about telehealth? Pick one that seems the most concerning to you. 8% chose that it doesn't combine well with existing processes and procedures. 32% voted that it does not work well with certain groups or clients. 44% stated that it feels like it would be less effective than in-person work. 8% stated technology involved difficult to learn and interact with. 0% voted creates unacceptable safety risk, and 8% voted other.
Terrific. Thank you all so much for your input to help us move forward in a more focused direction. For the 8% that answered other, I'd be interested in the chat box if you want to input what your concerns are so that we can make sure to address them within the presentation. And I want to start by just saying that telehealth is not a panacea. It is not something that can be the only tool that you use. I know Rowie will want to probably jump in on this too, but it's part of a range of tools that you can offer. So some of the concerns that folks are expressing around it not, being as good of a tool as other tools with certain groups and at certain times is absolutely the truth. So you are correct to have those concerns. It's my feeling that many of those concerns can be ameliorated by creating the type of program we're going to discuss today. So there are better ways to deploy this tool than other ways. And so some of it has to do with the kind of program you create, how thoughtful and educated you are when you create it, and the way that you run that program. But folks saying that they have concerns around this tool is completely valid. There is reason to have concern and to proceed with some element of caution and definitely with some thoughtfulness. Rowie, do you want to respond at all to that last poll?
That makes a lot of sense, and I think the key is to pick and choose and really decide in a thoughtful manner which services become good candidates for virtualization and which services are not going to be good candidates. And we're going to talk about it in a few minutes.
Absolutely. Okay, so let's keep moving forward. We're now getting into the kind of the background of telehealth and kind of scooping underneath. For those folks of you who are pretty new to telehealth, this is just some kind of introductory information. We also included some funny telehealth or Zoom memes. I'm sure you've been seeing these out there on the internet. I certainly hope that you get more than 2% of this meeting content. But I understand we were talking a little bit about Zoom fatigue before the presentation, all of us were. So if you'll hang in there, we do have some funny spots in the presentation as well. So to begin kind of the background, I wanted to talk a little bit to you about the need for telehealth. And one of the biggest things that telehealth can solve for you is any issues you may be having with access. Now, again, it doesn't provide 100% access. There are certain groups and certain occasions where it is not the answer. But particularly during COVID-19, I'm guessing many of your organizations have really struggled to keep communication with clients. Just looking at domestic violence shelters and domestic violence service providers for a minute, I'm certain that you've talked to clients who are hesitant to come into shelter for fear of infection or because they're under quarantine and prefer to stay at home. And even before this public health emergency, there are certain clients that would be hesitant, say, to come into a shelter or even come into a counseling office. So in small to medium-sized towns, there can be the reluctance to seek services, whether it's at a behavioral health provider or domestic violence service provider or a recovery center, because, you know, say somebody drives by the center and recognizes your car and therefore knows that you're getting those services and ostensibly that you have that issue. And so because of the stigma and because of people's fear of being identified, or say that an offender were to drive by and see your car somewhere because you're trying to seek services, there are lots of reasons, and we've known this for years, that there are lots of reasons why people aren't seeking out our, I'm going to call them bricks and mortar services. So services that rely on a place, also called place-based services. So if I have to go to my doctor's office, or if I have to go to a shelter, or I have to go to an administrative office to receive some sort of service. So for lots of reasons, during COVID, prior to COVID, and after this public health emergency, folks may not want to come to our buildings. They may not be able to, and it may cause issues for them. And so when access is interrupted, you can see on this graph kind of the drivers of potentially bad outcomes when access is interrupted, when people have, it says SDOH. In healthcare, we talk about social determinants of health. So that could be poverty, that could be domestic violence, addiction, co-occurring issues of behavioral health and addiction. When people have certain challenges, those things can get in the way, of course, of access. Other barriers to care may exist when our systems are fragmented and difficult to navigate, which we know that many times they are for our most vulnerable folks. And sometimes we have systems that respond very much after the fact. So somebody coming into shelter, that need for help, that need for intervention, that need for support likely has been going on for years before somebody ends up in a shelter, or before somebody ends up in jail, or before someone becomes homeless, or before we have some of these health outcomes that we see with our client populations. So with access being a real driver for these negative impacts, and you see some of the impacts that occur, which is as folks get sicker and potentially don't have the access that they need, then it's much more time consuming, much more costly, much more complicated, and a lot more stress on our social service systems to serve these individuals with kind of a final result or a final outcome, which we are all trying to avoid. So while it's great that someone can come into a shelter and an amazing social service that it is offered, I know, you know, particularly for you folks working in shelters, you'd like to put yourself out of a job. You'd like to not have people in the sort of situation where they have to leave their homes and everything they know and flee, essentially. So, you know, one way to reverse this graph, which is showing how acuity increases over time when you don't have access, and acuity meaning, that's kind of a healthcare term, but I know many of you can relate to it, just things getting worse for folks over time, again, because that access isn't there for them. And telehealth potentially being a major tool that can help resolve what you're seeing here. So access is not the only challenge that you all are facing right now. And many of these issues on this slide, again, predate COVID-19 and will post-date it. So although this presentation is geared to talk to folks about what to do during this pandemic, as we know, states are starting to open up and things are starting to shift even week to week. So even if we project ourselves months or years in the future, having a robust, durable, thoughtful telehealth program will serve you from here on out. Again, it's not just restricted to the time that we find ourselves in, although we have seen in the last couple of months, as is evidenced by the polls that we just took, that folks are really flocking to telemedicine right now as a way to extend their services, keep communication with clients, and provide for remote work, remote staff working during the pandemic. So just a few more points on this particular slide. I put client-centered on this slide because it is a value that many of us hold dear, this idea and this reality that what our clients express as their desire and as their need, we will attend to as advocates for them and as professionals within this space. And so clients are asking for access that does not depend upon them going to place-based services, particularly now. And so if we are really listening to them, how can we use telemedicine as one of those tools? Maybe not the only tool to listen to our clients right now, but valuable nonetheless, particularly in this instance. Certainly there's also shifting demand. So folks, again, maybe fearing going into shelter, maybe folks wanting to stop some therapy for a while and restart it later while they kind of sort through what's going on with domestic violence survivors. I know for many of them, their offender is also home all day long. And so potentially changing the way that they would like to consume services from organizations. But just and even the financial impacts that are going on. So for those of you who are in a fee-for-service environment, meaning those of you who get paid when you do whatever activity, whether it's an intake or an assessment or a crisis call, not having the ability to connect to people will really impact you potentially financially. So there's also that component of the need for telemedicine right now. If you have any questions, if you have any thoughts about this, if your organization has been facing any of this, I mean, the stress and fear component, when I put that in there, I was immediately thinking about what's going on for clients, but that goes across staff as well. So how could we be using telemedicine to help quell those fears of staff about going in to staff a shelter or to staff a behavioral health organization or a juvenile justice center? How do we use telemedicine to provide for remote work is also a value that it brings. So Rowie, do you want to jump in on this slide?
Sure. So, maybe that's a good point to level set and try to define what telemedicine or telehealth is. And almost, in a self-explanatory fashion, telemedicine is simply using technology to deliver care remotely at a distance. And the interesting thing, though, is that, with the variety of tools and technologies that we have, we can do it in more than just one way. If you look at the little schema, that little chart there, then you can see that we're seeing telemedicine being offered from a place of care to people's homes. But then we're seeing telemedicine being offered between places of care. So you can think about a telemedicine connection between a specialist and a primary care provider. And we're going to talk about the meaning of that in the social services arena in a second. But you can think about communication between two places of care. You can think about communication between a clinic and somebody's home. You can think about communication between specialists. You can think about communication between hospitals. So really, I mean, as long as we are offering care remotely and at a distance, this is telemedicine. So Kristen, maybe we can expand a little bit about what it means in social services.
Absolutely. And before we go into talking about how this applies to a social service environment, if you will put into the chat box a why, if you have witnessed or been a part of a telehealth visit in the last few months, or an in if you haven't. And that telehealth visit could be with your primary care provider, your doctor, or with a counselor, or within your own organization. I just like to get a read of, how frequently you all are, how familiar you all are with the process. Okay, so I'm not seeing a lot of Y's or N's yet. I wonder if there's a delay or if we have lost you already. Okay, well, while you all are thinking about that, or while it's waiting to show me, I'm going to continue on with the presentation. What Rowie just presented about healthcare can also be true in the nonprofit sector. So there's a lot of different types of connections that telehealth can help your organization make. The one we're going to focus on today is this one in red, which is how can your organization keep communication with clients? Okay, now I'm starting to get the results. Wonderful. Thank you, Lisa and Yvonne and Linnell, Michael. Wonderful. So it looks like about half and half as far as who has experienced a telehealth visit. And I'm guessing some of these experiences were good and some were not so good. I know the other day we had a counseling appointment for my kiddo, and I believe it was on Doxy, but just really poor connection, and we ended up doing it by phone. So, some of these visits probably went well and some not so much, but thank you all so much for putting those in the chat. Anyway, so what we're going to be primarily focused on today is how do you, as an organization or an advocate, keep connection with your client. But I want you to potentially more fully understand the capacity of telehealth to do other things. So you can also use telehealth to port in specialists. So when I say port in, I mean bring a video audio platform where specialists like a LADAC or a child therapist or an RN or a psychiatrist, somebody who has specialized skills that maybe you're not going to have them work on site. Maybe you don't even have enough clients to necessitate the need for on-site work, but they can port in once a week, once every couple of weeks, and work with clients. So I know when I worked at a shelter, I would have given anything to have access to a psychiatrist or a LADAC or somebody with some specialized skills that frankly we couldn't afford, and that we didn't necessarily need all the time. We just needed some infrequent support from them. And so telehealth can provide that linkage. Something else that it can do is provider to community partner, and you can see that arrow on this slide. So provider being you or your organization, being able to port in community partners. And one of the advantages that can come from that is you can do what are called community case staffing. So again, from my experience working in social services, I know from time to time when we can, we reach out to whoever else has connection to our client. Sometimes we're even able to schedule meetings or invite people over to our space so that we can all meet with the client. And those types of community connections and community care coordination are super effective in helping change things for clients and in helping them have more opportunity. The problem tends to be that they are very resource intensive. They take a lot of time. It's difficult to get everyone in the same room at the same time. But if you have telehealth and can connect everyone together to discuss what's going on with your client, it's particularly helpful in those cases where you just don't know what to do for someone. Things have gotten awfully bad. It's very complicated. Maybe somebody is coming in repeatedly and you're not seeing that you're really able to do what you want to do for them. This is a way to push through that, and telehealth can provide that linkage. So, you know, there's lots of different ways telehealth can connect people and improve things for clients and improve things for organizations. And again, we have our primary focus today, but there's so much room in the social service space to develop these connections and develop programs and initiatives related to what this now opens up. I mean, it can open up a whole new world for your ability to think about new services that could change things for you and your clients. And it's really, you know, the thing that gets me excited about telehealth is how creative healthcare has started to be in this space and how generative it can be for us as social service providers too. So Rowie, I'm going to turn it over to you to talk a little bit more. I know we keep flip-flopping and talking about healthcare and social services, and I know that can be difficult. We do want to give you concrete information though from healthcare to show you this has been done, this is being done. It's being done in a space oftentimes that has more resourcing, and that may be why it's taken hold and is moving forward more quickly there. But how can we as nonprofits and social services adapt, evolve, take from what's happening in healthcare and make it our own, make it serve our needs? So
thanks, Kristen. So this is an exciting time in telemedicine and telehealth. This is an emerging solution, emerging set of solutions, and thus, you know, it has broad usages and broad services that are based on telemedicine. And we just wanted to mention a few to give you a taste. And many of you have probably encountered some of these services just by going to see your doctor or your specialist. One fairly common service that's becoming more and more common is telepsychiatry or teletherapy. And you can imagine why this is fairly common, because in most cases, you really need nothing more than a smartphone or a video chat application. The reality of therapy is that it typically does not involve any physical exam. Then you have virtual medical visits, or you can have a nurse visit, a primary care provider visit, and see and consult with your doctor in that fashion. Something that's becoming more and more common, especially in specialty care, is the inclusion of remote wearables or remote patient monitoring. So you can think about patients with issues with diabetes. Nowadays, you can have folks wear, some kind of an insulin measurement platform that transmits results to a specialist, and then you have somebody monitoring the health of the patient on an ongoing basis this way. We have the same thing for hypertension and other issues. Kristen talked a little bit about the inclusion of specialists. So this is something we see more and more, this consultation with specialists of one provider, one clinician, transmitting questions and information to another provider to receive answers and more information about patient issues that otherwise may require a referral of the patient or an additional visit. Something I'm going to show you an example of in a minute is exam pods, but some of you might have seen that at some, Walgreens or CVS branches, where you can go into a little area and undergo certain medical exams, measuring your temperature, taking your vitals, and this is then being transmitted to a nursing station somewhere, and you can get your results, and you can receive consultation in accordance with those results. And finally, you also have virtual nurse consultations. Many clinics now offer that, where, just saving you the time of going to the clinic, and you can consult with a nurse. So this is, just a few common usages. There are many more, given how emerging the area is.
It's really, if I can add just for a second, just to get your creativity going, and I'm sure it's already going, and thinking about your own social services and how these types of methods could be applied to good advantage. It's not an idea. The reality of there being these exam pods where they're placed in the community, places that are accessible to your population, and then folks could, again, using the example of domestic violence, say there was a pod somewhere where you could go and see if what you're experiencing is domestic violence. You could do a little self-assessment, or, having the opportunity for your clients to find out information without having to make a special trip to your office has lots of advantages. And then, potentially even being able to connect that client who, did a small assessment or got some information in a pod, being able to connect them further, if necessary, to other resources. I mean, just even Rowie talking about it today gets me thinking of these different ideas and ways that we could implement these things. One other piece about the use of specialists, which we've been talking about, is, and we'll talk about this further in the presentation too, but not only what if we as individual organizations or individual service providers were to implement telehealth, but what if we created networks statewide with like providers? How could we share whatever burden there is to create the program, or to pick a tool, or to implement, or to bring in specialists via telehealth? How could we share that burden together, and how could we, do it in a partnering, organized, collaborative way, instead of each one of us having to recreate the wheel, everyone having different technology that they're using. This idea of, instead of there being 1,000 solutions that get picked and acted on, what would it mean for us to reach out to each other? And we don't have, all those solutions for that today, but just to kind of plant some seeds for you.
I don't want to interrupt, but Kim Jeans asked the question. She said, wouldn't this require contracts of some kind? Because what about HIPAA? If we are arranging this for clients, would there have to be an initial new patient in-person visit? What about insurance? We know none of these are free services.
We're actually going to talk a little bit about that as we continue with the presentation. So my suggestion, let's save this question a little bit, and we're going to address it in a few slides. All right. So many services out there that you can potentially offer using telemedicine. And given that you have so many services, there are also many technology offerings to support these services. So I wanted to address some of these common options. So as you think about the technology at the most basic level, and in many cases, the basic level is sufficient. All you need is a smartphone. But then more complex features require more complex and additional tools. One kind of basic choice is to think about whether you're going to go with a freestanding solution. Think about Zoom versus a solution that's embedded in your EHR or digital file record system. So kind of think about it as a tethered solution versus a freestanding solution. Freestanding solution gives you more flexibility. The tethered solution can then combine those features from your EHR or your digital file record and help you with documentation during the visit itself. Another type of technology to consider is if you do end up going with a pod or kiosk-based kind of solution, then the technology has to be a kiosk or pod-based technology, meaning something to allow both communication with the client, but also the submission of forms and questionnaires and intake of information. So that's another technology option out there. Another option we are seeing is something that's embedded within a client portal, or in healthcare, it's called a patient portal. And many of you have probably seen that going to your primary care provider. You're then being offered some kind of link so you can go in and check your exam results and perhaps even communicate with the provider. So some of these solutions also have telehealth platforms embedded in them. The advantage is that they tend to offer some additional features, such as you can do an intake, you can send client questionnaires, you can receive demographics information from the client, and then store everything electronically. So it offers you additional features beyond the just the communication or the chat. In healthcare, if you go with remote monitoring devices, then you need something to support that, meaning you're going to need a device, but you're going to need a system that can read the results from the devices and potentially analyze them and build alerts on top of those results so that you can have some kind of intervention. And finally, if you think about the involvement of specialists, but not in a live manner, but in this what's called an e-consult, meaning you have a question for a specialist and you'd like to submit that, you're going to need some kind of technology to connect between your system and a system used by the specialist. So again, you have a whole range or even a spectrum of technologies, starting from things that can be very simple through things that can be rather complex. And then just illustrating some of these examples, and I picked these because I found them interesting and even exciting. So at the kind of most basic level of the spectrum, many of you have seen these virtual nurse consultation solutions. And again, in many cases, this is just Zoom that allows you to communicate with a nurse. But something exciting that we're seeing more and more of, and that's become very relevant nowadays during the pandemic, is the tele ICU. Many rural hospitals out there have the beds, but not the ICU services, meaning they do not have the monitoring, they do not have the personnel, they do not have the ICU services. But we're seeing rural hospitals now joining in with other healthcare systems to provide centralized ICU services. So they attach to their ICU beds monitoring devices. These devices send results to a centralized ICU, almost a centralized war room, like you're seeing here in the picture. And then alerts are being generated and being read and examined by specialists in a centralized location. So this is a great way to provide ICU services even when you may not have an ICU. And finally, something I've seen recently, and I thought was pretty cool and exciting, is a teleophthalmology pod. And these come in varying sizes. There's even a kind of large size where you can go in and you do eye exams, and these eye exams are being transmitted to the ophthalmologist. The ophthalmologist reviews the exam. If there's a need for a follow-up, you're going to receive an invitation for a scheduled visit. And this is just a way to save the client, the patient, a physical visit to the practice and do all of these exams remotely. So a few exciting examples that I wanted to share.
Terrific. Okay, so now we're on to the part in our agenda where we're going to talk a little bit about the actual development of a telehealth program, what the components of that are, how you would embark upon this. And we have our little puppies over to the right. I'm afraid I've been veering toward the left puppy more than I might wish. But okay, so starting with a few of the pros and cons of telehealth. We covered a little bit of this when we talked about the polls that you did, that last third poll, talking about some of your concerns about telehealth. And again, to validate that those concerns are real, and there are cases where telehealth is not your best tool. And having discussions within your organization between leadership, administration, frontline staff, and clients to know, which populations will respond well to this, which occasions are appropriate, which are not, and developing the policies and procedures to support a proper program are really important. And we're going to get a little bit more into that as we continue. But, wanted to illustrate for you the most common kind of advantages and then limitations that I've heard folks talk about and that seem real to me. And for some of them, the solution is we're not going to use this tool in this case, and we want to develop another tool to use, or we're going to we have a kind of a plan B or something we're going to do instead. But in some of these cases, again, where there are bandwidth issues, some of that I believe will be resolved over time, where folks will have more access to internet. But as things stand today, not everyone has access to internet and will be able to participate in telehealth. And similarly, not everyone has the correct technology, even if they did have the bandwidth to be able to do some of the things that are on offer from telehealth. There are certain populations that have more difficulty navigating the technology, and certain populations that have some real safety concerns. I'm going to fall back to talking about domestic violence here. Within our resource page, we're going to give you some resources for how to know a little bit more about, well, a lot more about offering telehealth in a safe way to domestic violence and sexual assault survivors. But there are contingencies to be planned for here. And anytime, you know, I want to acknowledge anytime we reach out to someone like a domestic violence survivor, if their offender is in their life, there is a potential for them to be unsafe via that link, via that communication. But we know that if we don't reach out, if we don't establish communication, what the impact of that is as well. And so there's risk, inherent risk, anytime you offer a service or engage someone, that it may not go well, or that you may, you know, in fact, place them in harm's way. But how do we mitigate that risk? How do we inform survivors? How are we educated and thoughtful? I mean, those are the questions to me that are important in thinking about telehealth as concerns populations, particularly those with safety concerns. Of course, there's client and provider preferences, and some clients, even if they have access and they have the technology and it's an appropriate service to virtualize, they don't like telehealth, and that's okay. Same for some providers. It may not be how they like to deliver a service, but when we flip on to the next slide, there are some folks who really connect better via tele than in person. And so how do we articulate and separate those folks out and offer them what they need in a kind of client-centered way? And that is something to be thought of and planned through. And particularly, I want to say the younger generation that's become so used to using media and digital communication, I think as time goes on, we're going to see more and more preferencing of this type of technology as a way to communicate and link to services. So again, I know COVID-19 spurred a lot of activity in this space, but as we progress, as time goes on, I think providers that don't offer telehealth will really struggle to serve the need that exists in client preference. There can be some issues with clinical effectiveness. So doing a telehealth visit with an 8-year-old, you know, a therapy visit with an 8-year-old via tele, there are very few 8-year-olds that would be an effective means for providing that service. I'm not going to say there aren't any, but again, this is something for your organization to think about. But I can tell you with an 11-year-old, you know, that may be a different answer. And so some of it is case by case, but all of it is good fodder for you all to be talking about internally. Okay. And the challenges of a new service. So anytime you offer a new service, there can be folks who are adverse to change and don't want to get on board. You have to market the service to your clients. You have to let them know that you're offering it. There's new policy and procedure to be developed. There's that part where you're learning how to walk before you learn to run. And so this being a new service, there, you know, will likely be some trials and tribulations in the offering of it. Now speaking a little bit about the advantages, which Rowie and I have already talked about some of these, so I won't touch on all of them, but certainly access is a big one. The ability to offer remote work, folks working from home and being able to port in and provide services, decrease cost of care and being able to streamline care, And again, some clients and providers will prefer this means of communicating with clients. And it gives you unlimited opportunities really to evolve care and kind of move into the future in a different way. Okay, so that was the pros and cons. Now we're looking at really first steps. And we're going to talk about the clinical considerations, the operational considerations, the regulatory and confidentiality considerations, and the technology considerations. So that's a little bit of a preview of what's to come in this portion of the presentation. This first part, when I say clinical considerations, what I mean is how can you deliver high quality clinical care? How can you deliver services that you believe in a way that you believe in them, in a way that is effective with your population and that is client-centered? And so this slide gives you an example of how you can start thinking about which service or which activity you might want to virtualize. And so I've gone through here and just given you an example of some of the most common services that I know are on offer at your organizations. And, you know, is the service able to be provided remotely is a loaded question. It's not just, does it work in that environment, but is the cost acceptable? Are there regulatory or confidentiality requirements that would get in the way? You know, that idea of, is this a service that we can do this for, has a few different layers to it. Is there a cost tolerance that your organization has that it would exceed? Is it safe to be provided remotely? I mean, these are all questions under this larger heading of, can it be provided? And then there's the question of, does the demand exist? Do your clients want this? Are they asking for it? Are they responsive to it? I mean, everything takes a little while before it catches on, but over time, are they voting for this service in the virtual environment? And then lastly, what is your organization's priority? So particularly right now, what I hear from organizations in the telespace is that their priority is they do not want to lose communication with their clients, because they know when that happens, their client's really in trouble. And so, you know, a lot of folks have begun their telehealth journey with this idea of, I'm going to do what it takes to stay connected to my clients right now. But, you know, as time goes on, the priority may change, and that will change what services you want to virtualize and how you act upon that. Okay, and now I'm going to pass it back to Rowie to talk about the operational considerations.
Thanks, Kristen. So this is an interesting one. You know, as you can imagine, when you offer a new service, it's not just the folks rendering the new service, the clinicians that are going to be impacted, but your administrative staff and your operational processes are going to be impacted as well. So when you introduce these new services, you have to think about the impact that they're going to have on your processes and then adjust the processes accordingly. So what we're trying to do here is to think about a few key processes that come prior to the visit, and then some processes that come after the visit, to give you a taste of the considerations that should go into this. But pre-visit, you can think about the process of intake, meaning if currently the intake process is that somebody comes on site and somebody is being offered forms to fill out, then clearly when you have a virtual visit, you cannot do that, right? So do you have the means to process this intake remotely? Do you have the means to submit forms electronically? Do you have the means to obtain a signature somehow? But then another interesting question is, if it's not just the client that you are virtualizing, but your staff as well, think about the current pandemic situation. So staff is going to be home. So if the staff is remote, then do you have the remote access and the management capability to manage the staff when they themselves are remote? So all of this should go into thinking about your new intake process, and you should be redesigning it accordingly. Then think about certain services that may come prior to the visit. If you have an initial assessment, and that assessment used to be, again, a questionnaire. It used to be the client coming in and sitting in a room and filling something up. Then now you should probably think about a way of doing this virtually. Let's move to the next slide to talk about some of the post-visit processes. So some of the processes that happen after the visit may also be impacted. Many organizations have a discharge process, so the visit is over, but now we need to have a quick conversation with the client. We need the client to sign something. We need to point the client in the direction of education material. We need to perhaps sort out payment options with the client. All of this now needs to happen virtually. So do you have a checkout form that can be completed virtually? And again, if you virtualize the checkout staff themselves, do they have access now to a system where they can check out the client? If you offer follow-up services, which can happen right after the visit or on an ongoing basis, how is this going to happen? How will you be virtualizing these follow-up services? And if you need to obtain client input, how is that going to happen? Are you going to be obtaining input with a form or a questionnaire? Is this going to be an additional video chat? So this is another process that's going to require some redesign. And in some cases, it can be very easy and even self-evident. In other cases, it can be more complex. And finally, billing. So when you have services like therapy, for instance, that are available, do you now have the means to do the billing in a virtual manner? Do you have the ability to record co-payment or funding sources with the client virtually? Because again, just assume that the client is not going to be there handing out any identifiers or means of payment. And if the billing staff temporarily is going to be sitting remotely, then make sure that the billing staff can access the billing system, because otherwise you're going to have an issue with recording the payment. Let's move on to the next slide. So we wanted to touch on some of the regulatory and confidentiality considerations. Kristen, maybe you can talk a little bit about confidentiality specific for social services.
Sure. So within healthcare, the primary regulatory the primary regulations are around HIPAA, and healthcare has strict confidentiality, but there are exclusions to HIPAA, and so those exclusions are for treatment, payment, operations, and public interest. So even without getting a release from you, the patient, they can be sharing your information under those on those occasions. And when it comes to other social service providers, which I went ahead and outlined for domestic violence, sexual assault, drug and alcohol, as well as behavioral health services, some of the additional confidentiality and regulatory requirements, those requirements are even more intense, and for good reason. And so, you know, knowing what those requirements are so that you can meet them are important. I understand that many organizations jumped into offering telehealth because the consequences of not keeping that communication with clients was so intense. But to now be thoughtful about how are we abiding by the regulatory and confidentiality considerations of our funders is really important. And again, going back to kind of the domestic violence, sexual assault providers, there's an awful lot of guidance around this. And there are telehealth solutions that absolutely do not meet these requirements. And so, you know, it's important to, and to be honest, we could give a presentation just on confidentiality as pertains to any of these four sectors. So there's lots of information on this. It is important. I think as we come out of this pandemic, organizations will likely be held more and more accountable for the telehealth solutions that they've chosen.
So for those for those of you thinking about telehealth in the context of the current pandemic, it does make sense to notice that the rules, at least when it comes to CMS and HIPAA, the rules have been relaxed a little bit for the duration of the pandemic. So it kind of makes sense to quickly look at the situation pre-pandemic and now the situation during the pandemic in terms of privacy, and then some of the licensing and billing. On the privacy front, you know that the kind of the main governing set of regulations in healthcare is HIPAA. And prior to the pandemic, then technology had to be HIPAA approved. That excluded some handheld video applications such as FaceTime. And it also meant that organizations were exposed to HIPAA audits. Now, we're seeing a relaxation in those regulations. The audits are suspended. They'll come back, but for the time being, they're suspended. Most video chat applications are allowed. The exception is applications embedded into things like public-facing platforms like Facebook or Instagram, but otherwise you can use FaceTime, you can use WhatsApp. State rules still apply, but in many cases, the state rules follow kind of the governing HIPAA rules, and they are relaxed as well. When it comes to billing and licensing, so pre-COVID, we've seen Medicare insist that most telehealth services be rendered from a medical site of service, and that the client would be also in a clinic, a medical site of service. This is now relaxed. Medicare allows us to provide services when somebody is at home. Medicaid rules, you know, vary, but now Medicaid in many states allows for the same arrangement. The client can be home. Good sources here, by the way, are just the CMS various fact sheets, but also information in your state, in New Mexico, especially from the Alliance for Telehealth. The big question is obviously what's going to happen after the pandemic, whether some of these relaxations of regulations are going to remain with us, or whether everything is going to snap back to the previous state. Probably something in the middle. All right, so again, we're thinking here about a process where you define your services that you'd like to virtualize. Then you're going to see the operational impact of these services and adjust your processes accordingly. You're going to take into account confidentiality and privacy considerations and making sure that these services that you are building are kosher and abide by the confidentiality rules. And finally, it's time to think about the technology that can offer you the solution to enable the program that you're thinking about. So all these considerations that we have reviewed above should become inputs into a technology selection process. Clinical considerations, operational considerations, regulatory, confidentiality. Think about it as going into a funnel. defining your requirements, and then you compare these requirements to the offerings out there in the market. And think about the following questions. Are you going to go with something that's embedded within one of your platforms, or are you going to go with a freestanding solutions? Can you use a relatively simple solution such as Zoom, or do you need the ability to send forms and questionnaires? Do you need to get any input from outside devices? And finally, price. Some additional considerations you can find on the following slide. So beyond considerations related to the specific solution that you're going to go with, you need to think about your ability as an organization to offer certain technical support and to meet certain technical recommendations. So staffing, the more complex the solution that you're going to get is, the more staffing support and the more skill sets you're going to need to offer support for the solution. So, potentially if you're just going to go with a smartphone application, you're not going to need much staff support. But if you're going to go with something more complex, you're going to need somebody to support that. Supporting technology. So I'm seeing clients, many of my clients are, when they offer telehealth solutions, then, suddenly there's more traffic now in their networks, in their systems, especially when this comes with, the obligation to use a VPN solution. So then comes the question, can your network support the additional traffic? Obviously meeting IT security standards, but finally meeting client security standards. So, some solutions can look great, but then if they involve using a web browser, then somebody can then go in and see the history in your client's browser, and potentially the offender can track the history of the victim. So we need to make sure that these safety requirements are embedded into the solution that we're going to choose. And in some cases, this may be additional technology that kind of sits on top of the solution that you're choosing. So let's try and summarize this process in a nutshell. So really, again, what we talked about here is a process that goes beyond just the technology. It's a process of developing your program. And the key steps in this process are the following. Initially, we recommend that you analyze your clinical processes and then choose which clinical services to virtualize. Clearly, not every service is going to be a great candidate for virtualization, but some services are going to be great candidates and are going to result in offering additional access and much needed services in your communities. When you do that, you need to think about the operational disruption. So you decided, let's say, to virtualize therapy. Okay, so now what does that mean in terms of your intake process, discharge process, and billing processes? There's obviously an impact. You're going to need to redesign these processes, document them, and determine what the new process is, and then train your staff. You're going to need to think about the regulatory and confidentiality requirements, making sure that the services that you offer meet your organizational standards, but also the standards of the various governing bodies that determine the kind of regulations that apply in our cases. Finally, you take all of that and you match it with a technology offering, resulting in selecting a technology solution to enable the program that you've designed. So this is the process.
Terrific. And one thing that I can add to this, as I've come to understand telehealth and work more and more closely with healthcare, is that originally I had wondered if the technologies existed to do these things that we want it to do. And as I've come to understand it better, there is technology to do basically whatever your imagination can come up with. I mean, technology has progressed so much that now it's a question of how do we do these other steps, and how do we do them well, and how do we do them over and over again as the technology and the landscape around us changes. But the holdup or the problem is not, does the technology exist? The technology does exist. So we're going to spend just a few minutes talking about the future of telehealth and the future of what it would look like to implement. And we have one last funny slide for you.
All right.
Okay, so go ahead, Rowie.
So what does it mean to implement the considerations that we have reviewed? What does it mean to develop a program and then implement it? So in some cases, the implementation process can be very rapid. If you come to the conclusion that basically you just need to open access to Zoom for a minimal set of services, there isn't much of an operational impact, the process can be very quick. In other cases, the process can be slightly more complex. But in any case, you should be thinking about the following elements. First of all, training. So the jobs of some folks are going to change, right? Your clinicians offering the new services are going to need to learn a new care protocol. They're going to need to learn a new process of care. And then the impacted support personnel, let's say your intake personnel, your checkout personnel, your follow-up personnel, they will need to also learn a few new steps. So you're going to need to provide some training, potentially develop job aid materials, and potentially record some training sessions or deliver training sessions to make sure that everybody abides by the new processes and the new services that you've designed. A key element here is the element of designing the new process. So especially in these areas that are going to be impacting your operational processes, intake forms, the checkout process, the follow-up process. You're going to need to document and design this. If this involves, training your staff, you're going to need to train your staff, potentially developing metrics so you can report on the success of the new and the efficiency of the new process. And what I mean by that is, how many clients are able to check in and check out in this fashion, which locations, which locations where your staff is located have, a higher volume, which locations have, a lower volume, and then perhaps kind of balance load your staff and potentially monitor this over time and adjust your processes as you go. We keep saying that this is not just technology, but clearly there is the technology component, and the technology component eventually has to be deployed. And again, if this is something simple, then perhaps the technology deployment is not too complex, but there is going to be the process of finalizing a contract with the vendor. You're going to need to define users, configure the system. You'll need to nominate a system administrator. You're going to need to train your support desk to now offer services in this additional area as well, so that if somebody gets stuck, they have somebody to call. And finally, test the service before you go live. And I would say another element to take into consideration, especially in the not-for-profit arena and social services, is cross-site and statewide coordination. Meaning, if the state or some of the governing organizations, the funding organization, the organizations in the state decide to push for the deployment of some solutions and services at the same time, then it's going to be very important to be coordinated and make sure that you remain consistent with other organizations and with other community partners implementing similar programs and similar solutions. This will make working in concert easier as you go on and keep things consistent across the state. Kristen, I don't know if you wanted to add a little bit about this point.
Yeah, thank you, Rowie. I mean, I feel strongly that there's a lot of energy that can be saved, a lot of resources, a lot of money and time that could be saved by creating these statewide networks or coordinating across the state so that we're matching like service providers and creating similar solutions instead of everyone recreating the wheel and spending an awful lot of energy on that. And then again, reproducing this fragmented system that's using lots of different solutions, some of which work, some of which probably don't. You know, there's lots of economies of scale type of savings that can be reaped, and lots of kind of smoothing out of the system of care that could happen were we able to create these kind of partnerships and this type of coordination. So I hope we start to see that develop in New Mexico and really across the country. And then we're coming to the end of the presentation, so if you have any questions, please do put them in the chat box now, because we'll just have a few minutes for questions. This slide is speaking to some of the mistakes we're starting to see organizations make, and we wanted to communicate this to you, with the opportunity for you not to fall into these traps. Many of the pitfalls we've already attended to earlier in the presentation. So again, this need to not think about this as just technology, but see the bigger picture of it actually being a program. Making sure that you're finding technology that can be integrated into your clinical and operational framework, being thoughtful about which services you virtualize. One on this list that I feel an attachment to is this idea that, as folks maybe jumped into telehealth, there's the potential that they didn't have a good experience with it because they didn't have the time or potentially the support and information to make good decisions about telehealth. And so, I just want to see folks maybe go back and take some of these recommendations or take some more time so that they don't abandon telehealth or think that it's not a good tool moving forward because of these bad experiences they may have had in the past. There are definitely better ways to implement it than others. Rowie, any other comments on this slide?
No, I mean, I think it captures it. I would just add one thing that, you can also think about the process as iterative, meaning you may wish to decide with a subset of services, treat that as a pilot, and then gain some experience and add more complex services as you go on.
Terrific. And then lastly is that this is the resources we were able to find. At the top are resources for providers, at the bottom are client resources. And the reason for the client resources, I included those because those have a chat feature. I thought it was interesting that the domestic violence hotline and the sexual assault hotline are both offering chat features now, which is terrific. With the provider resources, the New Mexico Telehealth Policy and Telehealth Alliance, much of their advising is for healthcare, is for the healthcare sector. And then once you get to Futures Without Violence and the national network, the advising they have on those links is more particular to the social service sector. So I hope that you can use these resources, and Rowie and I are both available to help on any projects, or if you have any ideas or questions, please do reach out to us. We're very interested in seeing telehealth do well for folks in need. So let's open it up. If you have any questions, I think we're low on time. We just have a very few minutes, but we'd be happy to answer any questions you might have.
If you guys do have any questions, go ahead and place it in the chat. And I just wanted to remind everybody before everybody gets off, there will be a certificate that will be sent out for your participation today. You must have registered via Eventbrite and then registered on Zoom to receive the certificate. We will also be sending the PowerPoint that Kristen had shared with us. So I will be sending that as well. And a survey or evaluation is also required. It will pop up as soon as this Zoom has ended. If you guys can take a few moments and fill that out. We definitely take your feedback serious and really want to know how you guys feel about these webinars. And there will also be an invitation for Kristen's upcoming webinar on May 7th that you guys can also register for. Same thing, register via Eventbrite, and then make sure to register on the Zoom link as well to make sure that you are receiving the updates on that. If you guys have any questions, let us know and input it in the chat. And if you do have any other questions for me, my email will be training@nmcadv.org. I have placed that into the chat if you guys have any questions.
And thank you all. We haven't seen any questions come through, but thank you all so much for the work that you're doing to help those in need. We're really humbled by the opportunity to present to you, and yeah, anything we can do to help, please do let us know.
All right, guys. Well, you guys have a fantastic day, and thank you guys so much for joining us for this webinar with Kristen and Rowie.
Thank you, everybody.
Thank you so much. Stay safe.